Good afternoon, everyone. I am Dr. Nupur Gupta. I am the founder of 𝐕𝐢𝐭𝐚 Clinic and I practice gynecology at Fortis Memorial Research Institute, Gurugram, as a director. With an experience of more than 2 decades, I am here today to discuss with you the role of vitamin D in women's health and what is its emerging role nowadays. At the outset, I would also like to thank Healthcare Media, Healthwire Media, to give me this opportunity to speak about this topic today in our Facebook Live session. So let me tell you what I will discuss in today's session. Number one, what is vitamin D? What are the important sources? What is our daily requirement? What should be the normal lab values? How do you know that you are vitamin D deficient? What are the risk factors as to who is more deficient than others? What are important sources that we have to have our daily need of vitamin D? What is its implication in gynae health, in obstetric health, that is related to pregnancy and postpartum and the breastfeeding mothers, in elderly, where dementia plays a very important role? What are the myths associated with vitamin D and the toxicity? And currently, in the current era of COVID-19, that is the ongoing pandemic. So let us start with the first thing, which is called vitamin D, and it is a very important mineral for our health, not only women health, but for all of us in all ages. And that is why it is also called a miracle vitamin. For women, it is not only a vitamin, but it acts as a hormone as well. And it keeps women's hormones very happy. So it is a happy hormone as well. And unsung secret hero for women's health. Also a very vital vitamin for so many other systems of our body. And as you all know, its very important source is sunshine. So it is also called the sunshine vitamin. Till now, we know so much about vitamin D, but in earlier times, it was only important for our bone health, for our musculoskeletal health, for our muscle health. It also improved nerve conductions, that is our nerve health, and it regulates the absorption of calcium and phosphorus in our body. And that is how it used to play a very important role as far as bone health is concerned. But now, during the current era where a lot of research is already ongoing regarding its effects on our other systems, as the current COVID pandemic is ongoing, there is another pandemic, which is a vitamin D deficiency pandemic, a pandemic of physical inactivity, a pandemic of metabolic syndrome, where all these things have precipitated due to staying indoors for a long time. So as far as women health is concerned, why do women need this supplement after all? Why? Because it has been found that more than 50% of ovarian and breast cancers are preventable if vitamin D levels are good in our system. And did you know that even a chronic fatigue kind of symptom or simple tiredness can be a symptom of your vitamin D deficiency? So where does this vitamin D come from? So a very important source of vitamin D is the sunlight. And we all know कि धूप में जाने से विटामिन डी का सिंथेसिस होता है. और विटामिन डी कहाँ बनता है? विटामिन डी इज मैन्युफैक्चर्ड इन आवर स्किन इन द प्रेजेंस ऑफ सनलाइट. और सनलाइट में अल्ट्रावायलेट बी रेज होती हैं. और स्किन में एक केमिकल है डी हाइड्रो कोलेस्ट्रॉल. सो इन द प्रेजेंस of both the things, the vitamin D is synthesized, and following which it goes to the kidneys to get activated. But let us look at the scenario when sunlight से जो vitamin D बना, which is not good enough for us for to maintain a good health for all of us. So very important to have sunlight as a source of vitamin D. We need to go out in the sun. We need to have our body at least 20% of our body exposed to sun. और sun में जाने का best time है between 11 a.m. to 3 p.m. But there is another controversy which goes on along when we go out too much in the sun and during the daytime, and that is by the dermatologists. And they say that Lot of sunlight can lead to sunburn. That means you can have redness, you can have swelling, you can have pain. Then it can also damage your eyes. So mostly you need to wear goggles when you are out, because it damages retina and you can have early chances of cataract. Number three, there are chances of heat stroke because the sun is too much. Other than that, there will be early aging, that is wrinkling of the skin. So with so many side effects of excessive sunlight, it is very difficult to obtain your daily requirement of vitamin D through the sun. So what should we do now? Another thing which determines its synthesis in the skin is our skin color. So people who are fair skinned versus people who are dark skinned. तो स्किन में हमारे एक पिगमेंट होता है जिसको हम कहते हैं मेलानिन. So melanin is the pigment that gives color to our skin. So people who are fair skinned will have less melanin, and who are dark skinned will have more melanin. तो मेलानिन जो है, मेलानिन पिगमेंट acts like a sunscreen for us. So people who have more melanin, that means dark skinned individuals, in them vitamin D synthesis बहुत कम होता है. So their requirement is much higher. People who are geographically located at higher altitudes, जहाँ winters ज़्यादा होती हैं, वहाँ synthesis कम होगा. So we need to also look into account our skin color, the amount of sunlight, and so many other things, and actually how much extra time you will need to spend in the sun to be able to fulfill your daily requirement. So these are the people who will have less vitamin D in their body. The next thing that we come to is what is our daily requirement of vitamin D. So the daily requirement of vitamin D, when we talk about in all ages, for infants, it is almost 200 to 400 international units. When we talk about adults, it is 600. For elderly, it is slightly higher, and this is almost 800 international units, because elderly skin will have less dehydrocholesterol and there is less synthesis of vitamin D. At the same time, the pregnant women and lactating women, they have much higher requirement of vitamin D for the growing baby as well. So a lot of us get our vitamin D levels tested. If we go to the lab, there are different ranges that have been written, which says that the normal value is between is usually more than 50 nanogram per ml. 30 to 50 is inadequate, and less than 30 is deficient. But at the same time, there is another value which is more than 100 or more than 125, which is toxic for us. So we should not just pop in vitamin D pills that we need more vitamin D, our vitamin D levels are inadequate, because it will lead to more harm than the benefit. So coming to who is at risk of vitamin D deficiency. As we discussed, it will be children, it will be infants, it will be pregnant and lactating mothers, as well as elderly. Other than that, the dark-skinned individuals, they will require more of this. Another determinant is your lifestyle. If you are staying a lot of time indoors, if your religious custom makes you to be in burqa and you are not at all exposed to sunlight, depending on your environment, if you are in an urban area, if you are in a polluted area, the synthesis will be less. Your geography, where you are located in the world, so all these factors determine that how much vitamin D you will get and how prone you are. Suppose you are a pure vegetarian, you have milk allergy or you have allergy to dairy products, then also you will be more deficient and you need more of this. Another thing is the body mass index, that is your weight. So the more fat you have in your body, you will need more vitamin D. So there was a study which was done which showed that we know that vitamin D is a fat soluble vitamin. And where is it stored in your body? It is stored in the fat cells. So the more obese or the more fat you have, all your vitamin D will be stored in your fat. So very less amount is available to circulate in the body. So in a study, it was found that people who were trying, or women who were trying to lose weight, but they were vitamin D deficient, not because their levels are less, it is because they were obese. So most of the vitamin D was stored in the fat. So the serum level of vitamin D was less. And when they were supplement with vitamin D, it was very easy for them to lose weight. Another factor is when you are on certain kind of drugs, like you are on anticonvulsants, then you are on steroids, you are on laxatives, then also the absorption is less. Another important factor is you are immunocompromised or you are suffering from some disease kind of, which is malabsorption syndrome, any other bowel disease like cystic fibrosis, then liver disease, kidney disease where activation cannot happen, or if you have undergone weight loss surgery, and especially women who are postmenopausal and in the osteoporosis, and they have reached a stage where osteoporosis is going to set in. So how do I know that I am vitamin D deficient? We come to the next question. So, a common thing which we find in our day to day practice is feeling tired, feeling sleepy, don't feel like doing anything, chronic tiredness, sometimes in the form of mood swings, even depression, precipitation of psychiatric illnesses, and currently very important role as an immunity booster. It protects us against common flu and seasonal flu and common cold. And nowadays, people are popping in pills like anything, and it is causing more damage than advantage. Other very important role which I already discussed is in the bone health, your musculoskeletal health. So if your vitamin D intake is normal, it will help in calcium and phosphorus absorption from the system, maintaining a good bone health. So less chances of rickets in children and osteomalacia in adults, and also will protect women from osteoporosis after menopause. Then we come to the respiratory system. That means our lungs. It improves lung function, it improves lung capacity, and we will see that how it has even helped to cope up during these times when the lung was compromised at the time of pandemic. Even asthma, bronchitis has been found to improve. Then we come to cardiovascular health, that is your heart health. So it helps in control of your blood pressure, your disturbed rhythm, that is arrhythmias, and even heart disease. Uh, Even dermatologists have found it useful as regards their skin health, and it has prevented hair loss when vitamin D deficient people were supplemented with this. Even good results are seen in women who had psoriasis, that is kind of the skin disease. Some autoimmune disorders like rheumatoid arthritis and multiple sclerosis, which are very common in women, have also been found to improve and show some symptomatic improvement. Women who are trying for weight loss but are vitamin D deficient, as I mentioned in that study, and various studies have, we have seen that weight loss and metabolic symptoms improve when we supplement them with vitamin D. A very important role it plays in cancer prevention for breast cancer, ovarian cancer, and even in men against prostate cancer. Even colon cancer has been found to be more protected because cancer cells have found to have vitamin D receptors. So, a broad array affecting all systems, benefiting all the systems, but in the level which is required by the body and not at toxic levels. So, what are the sources of vitamin D where I can obtain? As we know, sunlight is not enough and it is not adequate to fulfill our daily requirement. So, where do I get this extra vitamin D from? So, number one is the food supplements that we eat. But if I'm allergic to milk, if I'm a vegetarian, then the sources are limited. But for vegetarians, don't worry, you can have mushroom that is sun dried, you can have methi dana, you can have haldi, almonds, and even milk products. Sometimes, even now, the government is fortifying the food, that is margarine, that is yogurt, and sometimes even milk to fulfill the requirement of this very important micronutrient and preventing so many other diseases. People who are non-veg, they can have egg yolk, they can have beef, liver, and some fishes like swordfish, sardine, tuna, mackerel. They are very good sources of vitamin D. Third thing, which we can take to fulfill our needs is supplements. So supplements are easily available. They are available off the counter. There are three kind of formulations that are available. One is a soft gelatin capsule. Uh, Another one is a sachet, which was available earlier also. But because it is fat soluble, you need to take it with milk so that the absorption is better. And the third thing is the nano shots or the drops or the liquid formulation that has come, and it has found to have a much higher bioavailability in daily practice. Now we come to a very important part of the talk is how it helps women as regards their gynae health. So there are five things how it helps. Number one, for females or women who have endometriosis, so their pelvic pain, their dyspareunia has found to improve. Women who are at risk of ovarian and breast cancer, it has been helpful. Women who are postmenopausal and there is a risk of osteoporotic fractures, and their requirement is also much higher, and we supplement them with vitamin D, it makes all the difference. Other than that, two very important problems that women face in day-to-day life is polycystic ovarian disease. And PCOD is the most common endocrine disorder that we see in women now. In India, if you talk about, almost 1 in 5 Indian women, whether adolescent or reproductive age group, have polycystic ovaries. And when polycystic ovaries women were supplemented with vitamin D, what was found that they were able to lose weight, their metabolic symptoms and metabolic profile improved, their lipid profile was much better, they responded to treatment, their ovulation improved, and similarly, a lot of junk of PCOD women also face fertility issues. When it was used for infertile women and women who were undergoing IVF or assisted reproduction, it was found that it reduced the visceral fat inflammation also in the obese population, thereby improving the chances of live birth. In a Denmark study, it was found that till the time their margarine or the butter was fortified with vitamin D, there was hardly any infertility or fertility issues in the general population. As soon as the fortification was stopped, there was a sudden rise in fertility issues seen in women. Next, very important topic that we come to is the pregnancy health. So in pregnancy, it has been found to have favorable results as regards less chances of gestational hypertension, that means pregnancy induced hypertension, less chances of diabetes in pregnancy and its side effects. In hypertension, it improves placental invasion and angiogenesis, and in diabetes the metabolic profile changes, and also women have been found to have less chances of low birth weight and preterm deliveries. It was found that women who were vitamin D deficient and when their newborns were screened and followed up, that these newborns developed childhood has asthma later on in life. So you can understand how important it is to supplement to pregnant and lactating mothers. Even mothers who are breastfeeding need to be supplemented with vitamin D. And if you talk about infants who are on formula feed, they will not require much supplementation as compared to infants who are breastfed, because breast milk will not have enough amount of vitamin D in their diet. The next thing that we come to is in the elderly population. Elderly population, we see lot of dementia. So there were two groups that were studied. One group was given vitamin D supplement and they were deficient, and the other group was not given anything. And what was found that in the group which received vitamin D, their attention span was better, their memory was better, their reasoning was better. So it has found a very important role in dementia as well. The next thing is some myths that are related to vitamin D. Number one myth is I feel that I go enough in the sunlight out and my I don't need any supplement. But that is wrong. As we discussed, sunlight is not enough to fulfill your vitamin D requirements. Another person says that I am taking multivitamins that has vitamin D, but that is also not enough. So you need to discuss with your doctor. Someone says that I my diet is good enough and I have no problem. Why should I take a supplement? I am not at all at risk. But we need to understand and fill the gap that whatever it is, the deficiency needs to be fulfilled. But nowadays, what we are seeing in clinical practice is people are popping in pills day in and day out because of fear of contracting coronavirus or COVID infection. But it has led to toxicity when it is not under any supervision. So there are mild symptoms in the form of nausea, vomiting, frequency of urination, even tiredness. And there can be severe symptoms affecting your heart, leading to arrhythmias, deposition of calcium in your blood vessels, even kidney stone incidence has increased. And sometimes people also present with bony pain or brittle bones. So vitamin D is not always safe. We need to keep a balance between the two. The last but not the least, I will come to the era of COVID-19, where we have found that yes, vitamin D supplementation in people who need ICU admission, who needed ICU admission, who were hospitalized, who needed ventilators, their requirement was less. There are still no national or international guidelines that tell us that yes, this needs supplementation, but it has been found to have very good. It has been found to have very good results in these people, and anti-inflammatory effects have benefited them to a large extent. And what is important is it is a vaccine. It is acting like a vaccine for all of us if we take adequate amount of vitamin D in our diet. And it has also helped patients who had a cytokine storm. A big Israeli study was done that found that yes, it is acting as a very good supplement for all of us. Uh, so, uh, so I have discussed a lot of points regarding this, and I will now take some of the questions from the audience. One is that is vitamin D deficiency linked to period pain or irregular menses? Uh, Not exactly, but yes, women who have found to have vitamin D deficient have found more period pain, and once they were supplemented, their period pain actually improved. And period pain also responded very well to vitamin C and vitamin E supplements as well. Another question comes that does it protect against cancer or any other disease? Yes, there is a long list that it gives protection against gynae cancers like the breast and ovarian cancer. Other than that, it has also been found to be protective against the colon and prostate cancer. Does intake of vitamin D preparation protect against cancer? Yes, it does. And what are the symptoms of vitamin D deficiency? So there are symptoms, basic symptoms will be थकान होना, bone pain होना, muscle pain होना, you don't want to do anything, you feel depressed. These are the general symptoms that we see, but there can be specific symptoms depending on any other illness that you might have, or it is affecting your respiratory system, your cardiovascular system, your neuro system, any part of the system. Does your body's own vitamin D production remain sufficient in older population? No. Older population, as I mentioned, their skin is not synthesizing enough vitamin D. Number one, from the sunlight. Number two, their requirement is much more. So we need to give them more supplements. Their daily requirement is 800 international units. But we have to keep a very good balance as to it is not too much, and it is requirement, it is fulfilling our daily requirement of how much we actually need and not overdosing of the same thing. I think I have covered up all the questions, and thank you so much for patient listening. And I would also like to thank once more HealthWire for giving me this opportunity to talk about vitamin D, what role it plays. And for today's session, my take-home message will be that please be in touch with your doctor when you are taking supplements. Don't overdose, and there is no need to go in for testing every now and then only when your doctor recommends. do a vitamin check, do your vitamin D test, but don't pop in pills because it is also toxic sometimes. Thank you for patient listening.